Hello all, this is Dr. Alsip, and we're going to finish up this section of videos by talking about some of the muscles of the neck and the back. And we'll talk about how some of them we'll discuss in later parts of the course. All right. So you can see we're going to start with our good friend, the sternocleidomastoid, and then we're going to talk a little bit about the supra and infrahyoid muscles, and then finish off with some of the deeper back muscles referred to as the erector spinae muscles. All right, so one of my all-time favorite muscles, the sternocleidomastoid. It has a long name, but the name tells you exactly where the attachments are. So the sterno is indicative of the attachment to the manubrium of the sternum. The cleido is indicative of the clavicle. So you can see that attachment here. So both the sterno and the cleido are the inferior attachments. And then the mastoid part of the name is telling you that one of the superior attachments is up on the mastoid process, those processes that you can palpate underneath your ear of the temporal bone. Additionally, portions of the muscle will go back towards the occipital bone as well. So if you're looking at yourself, it's going to be this rope-like muscle right here on the neck, very easily palpable, can serve as an important landmark for other structures of the neck. And as you can see here, these muscles cross those cervical vertebral joints. So that's indicative of which joints these muscles will affect when they contract. So with bilateral contractions, so contractions of both of the sternocleidomastoid muscles, you can have flexion of the cervical vertebrae. With unilateral contraction, so contraction of just one of the sternocleidomastoids, you can have lateral flexion of the neck and also rotation of the head in the opposite direction. And that's really where I feel like you can best feel your sternocleidomastoid, because it's contracting at that time. You can really palpate the whole length of the muscle. There are other actions that the sternocleidomastoid will play a role in, but these are the ones we're going to focus in on that you're responsible for. In terms of innervation, sternocleidomastoid is unique with its friend the trapezius on the back in that it is going to have a separate efferent or motor innervation from the afferent or sensory innervation. Remember, when we're talking about sensory innervation of a muscle, we're mainly focused on proprioception in that region. So the efferent innervation or motor innervation is coming from the accessory nerve or cranial nerve 11. And as you will talk more about when you get to the neuro section, accessory nerve is an example of one of the cranial nerves that is solely motor or solely efferent. So you have to get those afferent or sensory fibers from other nerves. And specifically, the sternocleidomastoid gets its afferent innervation from branches of the cervical spinal nerve 2 and cervical spinal nerve 3. So you can see some of those branches kind of coming off from that region and going to innervate the deep side of the sternocleidomastoid. There are other muscles in the neck. So sternocleidomastoid is kind of the big one. You can see that here. But if you're looking anteriorly, there's these fairly thin muscles in these regions. And we kind of separate them as to whether they're superior to the hyoid bone or supra, or inferior to the hyoid bone or infra. Both sets have 4 pairs of muscles. So the suprahyoid muscles, again, are going to be superior to the hyoid bone. These really form the floor of the mouth. And again, they will support, both sets will support the hyoid bone, kind of keeping it where it should be. But when they contract, they can also play a role in terms of elevation of the hyoid bone. Whereas the infrahyoid muscles, you can think about when they contract, they're going to pull the hyoid with it and depress the hyoid, and certain ones can depress the larynx as well because they'll have an attachment there. The infrahyoid muscles are sometimes referred to as strap muscles because they look like these ribbon-like straps, and they will cover these hidden things underneath here. So you have the larynx here, you have the trachea here, you have the thyroid gland right here. So the infrahyoid muscles are covering quite a bit in this region. There are a lot of muscles associated with the back, and we'll talk about the superficial back muscles with the upper limb because they can affect the movement there. And there are a tremendous amount of extremely deep back muscles, the multifidus muscles, These are literally these little bitty muscles that are going to attach specific parts of the bone to bone. So we're not going to talk about the deepest spinal muscles or the most superficial. We're mainly going to focus in on these kind of intermediate, but really thick and prominent muscles associated with the back. And these are referred to as the erector spinae muscles. All these deep back muscles are going to play a role in terms of extension of the vertebrae. So think about kind of standing up and extending and keeping extended. Also, these can play a role in terms of lateral flexion of the vertebrae, so moving from side to side. And these can commonly be strained. When we think about strained back muscles, it's generally these erector spinae muscles or maybe these deepest back muscles. If you think about lifting from the legs and not from the back, that's kind of the improperly lifting something. If you're lifting a heavy moving box, you want to lift from the legs and not from these deep back muscles. The erector spinae muscles can be separated into three kind of columns, but their functions are generally the same in terms of this extension and lateral, so we often talk about them together. So the most lateral of these are going to be the iliocostalis muscles. You can see some of these here. The intermediate or the middle are going to be the longissimus, and then the spinalis are going to be the most medial. Think they're closest to the spinal column. So I often remember these as I love spaghetti. That helps me in terms of memorize the order here. And you can see here that these divisions are separated into separate regions based on, are they more superior, more inferior? So if you're looking at the iliocostalis, you see the cervicus, those are going to be the most superior, thoracus, and then lumborum as the most inferior. But I don't want you to worry too much about these, but I do want you to at least know these three divisions of the erector spinae muscles. So if you're looking at an individual's back, generally you see these fairly distinct columns next to the spinous processes, and these are those erector spinae muscles. There's a lot more going on in the neck and the back than what we're going to talk about in this specific video, but we will talk about them later. So the superficial back muscles that I kept mentioning, your traps or your trapezius, as well as your lats or your latissimus dorsi, those are going to be the most superficial, most prominent muscles of the back, but they're going to affect the upper limb, so we're going to talk about them there. Pharyngeal muscles that are making up the pharynx, that's going to be discussed in the gastrointestinal section, and the laryngeal muscles and cartilages will be discussed with the respiratory section. All right, so last but not least, our review question here. Which rope-like muscle is important in the anterolateral neck as a palpable landmark? And hopefully you remember, I kept palpating it on my own neck. Is it the anterior scalene, erector spinae, latissimus dorsi, sternocleidomastoid, or trapezius? Hopefully this popped in your mind immediately. If not, go back and review how the sternocleidomastoid, which is this rope-like muscle right here on either side, is going to be an important anterolateral landmark. You can palpate it. You can get an idea of what's going to be more medial, what's going to be more lateral. Anterior scalene we didn't talk about as much. It is in the neck, deep neck, but not correct. Erector spinae, that's going to be deep back. And then lat and trapezius we didn't talk about either, but these are both superficial back muscles, and we'll discuss that a little bit later with the upper limb. All right, excellent. So we made it through this third portion of the course. We're going to move to thorax, abdomen, and upper limb in our next set of videos. I hope you enjoy your time in the lab to be able to review some of these structures. Thanks for your time and attention, and I'll see you in the next video.